I'm live. Hello, everybody. It's 4:30 on February 2nd. Hope everybody's doing well. It's hard to believe it's February. Some of you probably are freezing. I know some places like Chicago, it's really cold. But here in Baltimore, it's a little chilly, but it's dry and there's no snow, so life is good. This week, we're going to speak about imaging sports injuries, or sports injuries in general. And I picked this topic because it's kind of interesting. This, of course, is Cardiology Month. We've had some, if you go to CTisus, we're focusing on cardiology and the heart. Maybe it's better framed as the heart. Put up some incredible line drawings this morning, cases, the whole works. But the reason I put up the trauma thing or musculoskeletal injury is because if you watched TV last weekend, I didn't watch, but anybody who was a sports fan knows that there were two final games. And the one game, which was going to be amazing, San Francisco against Philadelphia, it had the story of a third string quarterback who became first string because his predecessors fractured their lower extremities, and he won every game. It was like a fairy tale. And then in the first series, as he was throwing the ball, someone hit him and he hyperextended his elbow. The long of the short was he was out. He couldn't play. He came in at the end because the other quarterback they had, who was their fourth string, limited experience, got them to 7-7, but that was about it. And he had a concussion. So Philadelphia, who may have won the game anyway, won the game in a walk because they really were not challenged. San Francisco could not throw the ball, so they cannot move the ball. If you know the team's going to run, it's easy to stop the run. So it ended the Cinderella tale, but more importantly, it made the point about how important injury is in sports. We always knew that, but how radiology plays a major, major role in sports. Because if you think about the second quarterback who got injured, he had a concussion. There's been a lot about concussions this year in football. Football is a very physical sport, and I would not let my kids do it. I wouldn't do it. People love football, but it takes a lot out of you. But this concussion thing, despite the new helmets and everything else, has been a big problem. You think about Miami this year, their quarterback had like 3 concussions. The good news was I read yesterday that he's doing fine, and he finally is off this concussion protocol. But should he play again? Is he going to be more prone to concussions? He had 3 in one season. And the last concussion, he wasn't even knocked out. It was just that he was making bad decisions. And they wondered about the next day and got some doctors to look at him. And they said he had a concussion. So it's not simple and it's not funny. But imaging plays an important role in concussion detection. Imaging plays an important role in looking at the problems people may have because of repeated concussions or injury. Tom Brady knew when he walked away it was time. The same thing about the first quarterback. He tore his medial collateral ligament and will need Tommy John surgery. Now, Tommy John surgery is an amazing surgery. It takes players who would be retired. Remember Sandy Koufax? He retired at the peak of his career because his arm would swell up like this. But it was really his medial collateral ligament that was the problem. And if he would have been around today, they would have done surgery. He would be out for a year, and then he'd be back better than ever. Think about some of the pitchers this past year doing that. So radiology plays an important role in detecting injury. It used to be in sports, the big injuries were like an ankle fracture, a wrist fracture, got hit by a pitch. You got maybe some people have had facial fractures, but ribs and bone. Now so much relates to MR. Ligamentous injury. What does the cartilage look like? The patient has pain in their throwing arm. What's going on? Before you couldn't diagnose it, now you can diagnose it. The same thing with concussions. The same thing with hyperextension injuries, saying that don't worry about watching that quarterback. He needs surgery. He needs it now. And the sooner he gets surgery, the sooner he starts recovery and the sooner he can come back. There was a thing a few weeks ago where there was a second baseman, a shortstop, who was going to go to the Giants, and with a $300 or $400 million contract for a dozen years, which I think is crazy, right? Almost every one of those contracts, the players at the end are worth little. But nevertheless, they backed out of the contract because he had years ago had a fracture, and there was question as to his healing because of the way the plate was placed. And they didn't want to agree to the contract because of that. And then the Mets said they would take the contract. And then the Mets physicians also said, I don't know about this ankle. It's okay now, but he's having pain now. And 12 years from now, will he be able to run? He's a shortstop. Will he be able to pivot? What is going to happen? So now imaging becomes critical in deciding who's traded. People want MRs of the elbow in pitchers before they sign them and the shoulders to see what the wear and tear has done. It's very interesting how far radiology has gotten, that it's a critical part. Teams have always had physicians, right? Team physician. But now the team physician, who often was an orthopedic surgeon, now the imaging becomes critical. There usually are, really people who are experts in sports medicine. Those are the surgeons. But it's wrist people, elbow people, shoulder people, knee people, back people, all different people. And the same thing with musculoskeletal. There's experts, different parts, CT, MR, and sports medicine has become such a big part. Of course, what works well for the people on TV works well for all of us, right? People who jog too much, who run too much, stress fractures, ligamentous injury, all sorts of things, back problems as you get older. Again, looking at patients and trying to figure out what is the best exercise for you, not that you could do it now because you're 23, but when you're 35, you look like you're 97 years old. So a lot really is the interest in how imaging becomes such a critical part. You look at basketball. The big problem now is players, it's an 82-game season, and the playoffs start. The playoffs can be 20 or 30 games. No one really worries about the season, as long as they get in the playoffs, of course. But once you're going to make the playoffs, then you start resting the stars. Well, if all of a sudden you're resting LeBron, which is probably a good idea, but fans who pay money to go to the game do not want to see the second string players. And if they're visiting Baltimore once a year or Washington once a year, you want to see LeBron, not someone off the bench. This is becoming a bigger problem. The NBA doesn't know what to do about it because people are really upset about paying big bucks and then watching a bunch of second stringers. It's like going to a concert to hear Adele and you hear Susie, or to hear Clapton and you see Schwartz, Fishman, or something like that. So it's becoming more and more, maybe it's a great specialty or subspecialty to go into. Expertise is needed. And again, whether it's on recuperation, whether it's on prevention of injury, whether it's designing better helmets with concussions, what do we need to do? Radiology can become very involved. I think often it's the surgeons who get involved, but I think radiology can make a big push because so much of what we do, they need. And we can show them what exactly we can do. So I think it's very exciting. It's, again, you're going to watch TV, not this weekend. There's no football, or maybe there is, I think, the All-Star game. You're going to watch the Super Bowl. The Super Bowl will be decided. One team will win, one team will lose, but it could be an injury in the first quarter that makes the difference. Someone pulls a muscle, someone tears something, someone dislocates something, someone gets a concussion. We have trainers that try to make people stronger, but sometimes, that extra conditioning actually works against you. So it's interesting. I thought I would speak about that, and you could think about that. Are you doing a lot of sports medicine in your practice? Think about that. Anyway, I hope everybody is doing well, and I hope everyone has a great day, and I'll see you next week.